My name is Rabatsene Kwadiba. I'm going to be presenting to you on the topic targeting multiple risk factors reduces the chance of getting macrovascular or cardiovascular disease better than targeting blood sugar alone. First, I would like to define the terms in that title. The first term is diabetes. Diabetes is a condition whereby your body fails to control your blood sugar properly. The second term is type 2 diabetes. Type 2 diabetes is a condition whereby your body fails to efficiently use a chemical called insulin, and we call that insulin resistance. Insulin resistance is usually accompanied by an overall shortage of insulin in the body, even though sometimes insulin may be in normal concentrations. You may be asking yourself, what is insulin and what does it do? Think of insulin as a key that unlocks the body parts that need blood sugar as an energy source. Just like you need a key to unlock your house or your car, these body parts, they need insulin as a key that will unlock them in order for the blood sugar to enter. The next term is a macrovascular or cardiovascular disease. These two terms are interchangeable somehow, and it refers to the disease of the large blood vessels in the heart, the brain, or the large blood vessels that supplies your legs and feet with blood. If your blood vessels that are affected are in the heart, you get heart disease, including heart attacks. If they are in the brain, you get strokes. But if they are the blood vessels that supplies your feet and legs, you get what we call peripheral vascular disease, whereby your blood vessels become narrow or they get blocked. The next thing is the risk factors for cardiovascular or macrovascular disease. Those are conditions or bad habits that increase your chance of getting macrovascular disease. And they can be in two categories: the non-modifiable risk factors, the ones that you don't have control over, or the modifiable risk factors, and those are the ones that you have control over. Example of the non-modifiable risk factors are age or your family history of getting macrovascular disease early. That is, for example, your close male relative like your father, if he got heart disease or stroke at an early age, less than 55, then it's a risk factor for you. Or your mother, if you got it less than 65, it's a risk factor for you. But you don't have much control over those. That's why we call them non-modifiable. Now let's concentrate on the modifiable ones, the ones that you have control over. Examples are diabetes itself, especially if the blood sugars are uncontrolled. It's a risk factor. The second is high blood pressure. If the blood pressure is high, your heart has to pump harder in order to push the blood through those blood vessels that are affected by high blood pressure. That puts a strain on the heart and also may damage those blood vessels. The next thing will be blood fats or cholesterol or lipids. If your blood fats or your cholesterol is high, it's a risk factor, because those blood fats, they get deposited inside the blood vessels, and as they accumulate, the blood vessel becomes narrower, leading to sometimes a blockage. And if that happens in the brain, you can get a stroke. In the heart, you get heart disease or heart attacks, as I've already mentioned. And then the other example would be smoking. Smoking also increases your chance of macrovascular disease, and you have power over that. You can control it, you can stop smoking. And then the other one will be physical inactivity. Itself is a risk factor, because with physical activity they come obesity or somebody becoming overweight, and the fats also can increase in the body. And remember, diabetes In order to control it, you need to use exercise, diet, and medications. So if you are physically inactive, you may even have uncontrolled blood sugars, which means then your risk factor still goes up. Now, diabetes is a risk factor, as we've already said, and it increases the chance of getting macrovascular disease very much. That's why over the years, many studies were done to evaluate whether reducing blood sugar alone as low as possible, just targeting that, will reduce the chance of macrovascular disease. Or, on the other hand, other studies were done to evaluate whether when you target multiple risk factors, including blood sugar, if that will reduce the chance of getting macrovascular disease. First, I'll start with targeting blood sugar alone. Many studies were done that actually had that target. They aimed at reducing the blood sugar as low as possible. And one particular study, called the Accord study, actually aimed at reducing the blood sugar even to the levels of people without diabetes. And what they found was not what they hoped for. They did not significantly reduce the risks of macrovascular disease, while at the same time their study saw that that strategy increased the risks of mortality or death in those patients. And the reason why death or mortality increased is still unexplained today. So what do we learn from Accord? That with lowering blood sugar is all about individualization of blood sugar targets. People are different, and you cannot have a general target for everybody. For example, a younger patient, 40 years old, who have not developed a lot of complications, they benefit more from lowering their blood sugar aggressively to as low as possible, as long as you don't expose them to dangerously low blood sugar levels or other dangerous side effects. But for someone who is old, 90 years old, they've been having diabetes for years, they've also developed some complications such as heart disease. If you try to lower their blood sugar too much, you actually may not get what you hoped for, just like in the Accord study. So it's all about individualization of blood sugar targets. Now, getting to targeting multiple risk factors. There's one study in particular that I would like to mention. It is called STENO-2 study. The STENO-2 study researchers, they targeted multiple risk factors on top of lowering blood sugar. They targeted risk factors such as blood fats, high blood pressure. They even gave aspirin therapy to people who need it. And aspirin is a drug that lowers the chances of getting blood clots in those large blood vessels. What they found was significant. They were able to reduce the risk of getting macrovascular or cardiovascular disease in those patients without exposing them to the dangerously low blood sugar levels. And what do we learn from this? Is that when you target multiple risk factors, you don't necessarily have to go even too low on the blood sugar to get expected or to get good results. What I like the most about this study is that even though only 15% of patients were able to achieve their blood sugar targets, the study was still able to significantly reduce the risk of macrovascular disease. So what do we learn from this? Targeting multiple risk factors is able to reduce the chance of getting macrovascular disease better than targeting blood sugar alone. So talk to your doctor, talk to your healthcare professionals. Together you can come up with ways of targeting or controlling all those risk factors and hence significantly reduce your chance of getting macrovascular disease. Thank you.